Good day, everyone. This is Kuneet, and today we have a very good news to share with all of you. This is regarding a collaboration that we at Medigence have now officially have with Titan Physiotherapy Center in Nigeria, which is based out of Abuja. So I have today with me Dr. Vijita with us, who is the director of tele-rehabilitation, neuro-rehabilitation services at Medigence. And I have Dr. Chemaka with me, who's the head at Titan Physiotherapy Center. So we are glad to announce this collaboration, and this collaboration, with the help of this collaboration, we are pretty sure that we will be able to provide access to remote rehabilitation services to people all across Nigeria, and we are really very happy about that. And this session that we are doing today is to brief you about what kind of collaboration it is, what kind of services to expect, and how do we plan to reach out to people of Nigeria who may be based out of any corner of the country, and how we intend to assist them when it comes to neuro rehabilitation services. So thank you so much, Dr. Vijita and Dr. Chemaka. So Dr. Vijita, first of all, I'll ask you that what is this collaboration about, and what do we intend to do with it?
Well, thank you, Gunni, for the introduction. So this collaboration is between two pioneers who are providing quality and affordable healthcare across the globe. Medigence, as a company, it is a TEMO certified healthcare organization which has been in operation since 2016. And along with our other verticals, we have a strong platform of tele-rehabilitation through which we deliver neuro-rehabilitation programs or rehab programs for patients suffering from stroke, from Parkinson's, or after brain and spinal cord injury through our robust in-house platform. We have been delivering this program for the past decade, and it has been quite efficient in making patients with neurological disorders gain their functional independency and return to community living after such a debilitating disease. And so this collaboration would obviously help us to reach more patients who are located in remote areas of Nigeria. And through Dr. Chiamaka, we would be able to help more people suffering from such neurological diseases.
Perfect. Thank you so much for sharing your thoughts. Now, coming to you, Dr. Chamaka, how do you think that this collaboration is going to benefit people of Nigeria? And what's the current situation over there, and how do we intend to improve it with the help of this collaboration?
Okay, so what this collaboration with Medigence is going to do for Nigeria is that it's going to give us access to it's going to give access to rehabilitation service to a wider range of people. Now, currently in Nigeria, we have a problem with access to physiotherapy services, rehabilitation services. Basically, there are a lot of areas, a lot of states don't even have physiotherapists on staff in their state hospitals, and the people that have, they don't have a rehabilitation team. What we have presently in Nigeria, physiotherapy is just barely reaching 70% of the population, not to talk about other members of the rehabilitation team. So with this collaboration, it's going to give Nigerians access to a full rehabilitation team, quality services, internationally trained medics, and all that. And it's going to enable us reach to these barely reached areas. So what it means is that you can stay wherever you are in Abuja, Lagos, even in the abroad, and you can book rehabilitation service for your loved ones in the lesser reached areas, in the rural areas, in the smaller communities, and they have access to rehabilitation. What it also means is that neurological conditions, things like stroke, Parkinson's, now doesn't limit your function. You can get them back to full function. Hopefully, this is what we hope to bring to Nigerians.
Sure. And I'm pretty sure that this collaboration is going to be a win-win for the clinical team as well as people of Nigeria, because people of Nigeria will finally be able to access the expertise that's lacking maybe in the remote regions, or maybe they do not have any access to any kind of rehabilitation, or sometimes they don't even know that they are suffering from a condition and there's no proper diagnosis. And the clinical team, with this collaboration, the clinical team will be able to provide the expertise that they already possess. So my next question would be, what all conditions, Dr. Vijita, do you think that can be taken care of through neuro rehabilitation? And possibly, if you can, Dr. Chamaka, expand on what kind of conditions are present over there that can be, that people of Nigeria will be open to, or maybe they look forward to receiving rehabilitation for.
Neurological conditions such as stroke, Parkinson's, or brain and spinal cord injury, they limit the functional activities of daily living in a person. So, and the best part is that these treatments do not require any sophisticated equipment to be treated for the treatment to be delivered. So it would be very easy for our experts here to deliver this program through our platform to the patients there with the help of any attendant or Dr. Chiamaka's team there. So these are the areas which we would be focusing. And our rehabilitation protocols include every aspect of rehab, that is physical therapy, speech therapy, cognitive and behavioral therapy, occupational therapy, diet and nutrition management. So it would be a complete holistic approach which would be given to patients suffering from such neurological disorders.
What do you think that, what are the certain conditions that Nigerians will finally be access neuro rehabilitation for through this collaboration?
Okay. Thank you very much. So right now we have what I think one of the members of the rehab team that the Nigerians are going to be so happy to get on board is the speech rehabilitation aspect. Now, this is an area that is largely lacking in Nigeria. The only places you can find speech rehabilitation, speech therapists are Lagos, Port Harcourt, and Abuja presently. So in places like Anambra State, Enugu, Imo, Ondo, areas like that, they don't even have a single speech therapist. So in states like Anambra State presently, there's no single speech therapist. We've had a lot of clients coming with speech therapy, speech problems after neurological issues, and there's no one to refer them to. You have to refer them out of state. And this is becoming a problem. Now, because telemedicine is not something that is widely acceptable or even something that we have the framework to deliver in Nigeria, it's difficult to say, okay, let's consult over the phone and see what it is to do. So what this collaboration basically is going to do is that it's giving us access to these professionals that we don't have, and it's going to help make the rehabilitation process a bit more holistic, or holistic in the real sense of it. Even down to, apart from neurological conditions, we have children with speech therapy issues that would benefit from having access to a speech therapist. These are things that we've not been able to deliver to them in the past. So this collaboration opens Nigerians up to so much more opportunities.
Thank you so much for answering that. And as an organization, Medigence wants to make global healthcare accessible to people. But when it comes to accessibility, it also means that people have to understand what does it exactly mean, and what kind of services are available that they can have access to from the comfort of their homes. And neuro rehabilitation is one thing. So anybody looking at this session later on may think that, what exactly is remote neuro rehabilitation, how does it work out? So what I want to ask here is just to clarify for the people that most of them have a myth that neuro rehabilitation cannot be performed remotely. So you need someone to touch you, you need to be physically present for the assessment. So what do what exactly do both of you think that whether it can be delivered remotely, how successful it is, and what would be your message for such people who think that it's something completely new and cannot be done?
So basically, neurological rehabilitation is different from orthopedic rehabilitation. In orthopedic rehabilitation, you are treating symptoms which is causing you some kind of trouble for a period of time. But in case of neurological rehabilitation, the central nervous system is involved, which basically compromises the functional abilities of the patient. So if you just think it in terms of layman terms, it is very it is very obvious that any kind of functionality in a person can only come back if he or she uses that part on his own. If for example, if the right limb function, right hand is not functioning properly, then the patient has to use his right hand to get the functionality back. Basically, we treat the non-use syndrome. I'm not using any technical terms here, but this is very general terms, that after a neurological disorder, we treat the non-use syndrome. The physical abilities of the patient basically is compromised because of non-use. There is the signals from the brain to the spinal cord is compromised. So, however, the more the patient uses his functional abilities through the exercises that we offer through our program, the more the patient would be getting better. Now, the coming to the second part, that this is not effective when we will not be customizing subjecting the patients to any kind of generalized exercise. Each and every protocol would be customized according to the patient's condition at that point of time. So and there would be no pre-recorded videos which would be given to the patient to be performed. There would be experts who would be delivering the session or performing those exercises here at the center or at Dr. Chiamaka's center, and they would be doing the same protocol at their home with the help of the attendants or Dr. Chiamaka's team members. So the delivery would be complete. The delivery would not be compromised at any level. And as I said, because of the customized protocols, the patient would benefit completely with the program.
Thank you so much, Dr. Jamaka. Would you like to add something to it? That providing neurorehabilitation remotely is often considered as something that people are not aware of what kind of services they have access to. So, what do you think about that?
Okay, thank you. One thing, a problem we have in Nigeria is that we have a myth that rehabilitation services always involves massage, people touching you, pressing you, that's the way. That there's a common misconception that anything neurological has to do with blood flow issue, that the blood is not flowing to the region well. So they want someone to touch you. This is what has made traditional bone setters and quacks very popular in Nigeria. Because when you offer people that someone is going to come into your home and massage your father and the Parkinson's disease is going to go away, he's going to stop shaking, people are quick to take it up. So one thing that neurorehabilitation is not. Neurorehabilitation does not require people to touch you to do this thing. If COVID has showed us anything, COVID showed us that healthcare can be delivered via virtually. Healthcare can be delivered remotely. So we hope that in addition to bringing this into Nigeria, this should prove to people that some of these things is going to go a long way into breaking the myths we have around neurological conditions. And hopefully this is going to make healthcare so much better in Nigeria.
That's true. That's true. And that's especially true when people do not have an immediate access to something that's not available within their vicinity. So more or less, they have to rely on such kind of services that they have easy access to and a quick access to as well. So coming to my next point of discussion. So what do you think that a patient would typically need? What kind of infrastructure would be required for them to avail neurorehabilitation sessions for any condition, be it Parkinson's disease or maybe for stroke rehabilitation? What do you think? What kind of infrastructure or in terms of services will be required by them?
So along with the clinical equipment, which Dr. Chiamaka would elaborate, I would tell you about the technical aspects which would be required for delivering this program. Basically, we require a computer setup and with a high-speed internet, and a space which is equivalent to a small room with preferably a couch present, so that the exercises which are demonstrated can be done effectively. This is the bare minimum requirement which is important for delivering this session for people in Nigeria. And the clinical aspect, I think Dr. Chiamaka would be able to tell better, because she would be taking up that responsibility there.
Thank you. So, in addition to what Dr. Vijita said, every other thing that you're going to need for the rehabilitation process is going to be provided and delivered by us to your location. So basically what we require is that the patient has access to internet service, which is something that we have all over Nigeria right now. So once you have access to internet service, every other thing will be provided to us. It will be sent and delivered to your doorstep. And if all the medical records we need, another thing that will require is for you to have your medical records handy so that you can easily upload this to us and we'll receive it on your end. So after assessing via medical records, video conferencing, and seeing what exactly it is that you need, then every other thing you need for the rehabilitation service is going to be delivered to your doorstep.
That's really great to know, and that's in fact a benefit for people of Nigeria as well. First of all, they are getting access to rehabilitation from the comfort of their homes. They do not have to visit in clinics, especially if they're living in a remote area. And second of all, they are getting the basic equipment delivered to them to enable them to receive neuro rehabilitation sessions effectively. So that's actually very good to know and very informative for people as well. It will help them understand that how actually it all works out. My probably I think the only thing left for me to discuss is that, you know, how exactly does monitoring take place when it comes to neuro rehabilitation? Because when you see a person in clinic, it's easier for me for them to, you know, have a discussion with the clinician, and you know, for the clinician to monitor the progress and discuss in person. So, you know, when it comes to neuro rehabilitation, how does that follow-up mechanism and that kind of monitoring take place? Because that's one of the most asked questions from the patients, and it's, you know, if we can discuss a little bit about that, it'll be easier for them to understand as well.
So Guneet, basically, doctors team there at Nigeria at Titan Physiotherapy, they would be receiving the patient at first, and they would be conducting the initial assessment of the patient either at their home or if they visit the clinic there. The initial assessment would be conducted, and then we would together create a protocol for the patient and explain to the patient how the process would go on from there. Now, regarding the monitoring part, their team would be present to take up on the cases every single day. And after every 2 weeks, we would be having a common discussion on the progress of the patient through video consultation. So this is the method which we would use to track the progress of the patient's recovery journey.
Okay. And any feedback from you, Dr. Chiamaka, about monitoring the progress of the patient?
Yes, I had something to add. So in after the initial assessment, before your rehab plans are set out, one thing we are going to do for the patient is that we are going to set out a goal, patient goal, individual patient goal. So how we are going to monitor progress is, have we met the certain goals that you set for the listing? We basically run a patient-centered approach here. So what we do is that according to the goals you want to meet, do you want to be able to walk your child down the aisle? Do you want to be able to go to church for Christmas Day? These are goals that we are going to do. So progress is going to be monitored on, have we met your goals? So that is what we are going to focus on here at Titan. So both we have video conferencing, then when you need us to come in, you can either visit the clinic again, or we can come into your home and see how progress you've made. So it's not as if we're going to set you up for rehabilitation and abandon you. No, we are going to always be present at any point you need us.
Right. Thank you so much. And in fact, you know, it's very important to make a note of the progression as well, so that the plan that was set initially, the goals that were set initially, so that, you know, the clinical team can also see whether there is any requirement for any modifications, any new exercises to be added, any approach to be changed, or maybe if we need to alter the duration of the plan as well. Since the team will be offering customized plan, which is going to be as per the expected outcomes of the patient and not time based. So it's very important to have that follow up mechanism, which I'm pretty sure that both of you have already come up with the entire execution plan regarding follow up mechanism and how, you know, it's going to work out. So maybe, you know, any last words from both of you about people of Nigeria, how, you know, how they can, you know, now they have access to remote healthcare, especially neuro rehabilitation. So your last words on you may want to inform people.
So I think this would be a great opportunity for people who have suffered debilitating disease, and they feel that they have no uh, they feel that they will be in that crippled condition for a lifetime. So this brings a great hope. This collaboration brings a great hope for those patients, and we assure you that together we will achieve more and deliver more.
Sure. Dr. Jamaka?
Okay. What my last words are going to be that this collaboration is going to be amazing for Nigerians. We know what our problems are. We know we have poor access to healthcare. We know we have brain drain, which is taking the best minds out of Nigeria. So what this is going to do is that we are giving Nigerians access to a bigger rehabilitation team with international standards, evidence-based management. It's going to be awesome. So this, what it also means is that even you in the diaspora, you can book rehabilitation sessions for your loved ones back here in Nigeria that have issues, and we are going to be delivering international standards to them. So I think this is an amazing thing for Nigerians in general, and I can't wait for you people to see all we have in store for you.
Well, very well said, and thank you so much to both of you. And I really, really hope that both the organization, both Medigence as well as Titan Physiotherapy, are able to realize their vision of reaching out to people who are in dire need of such services, and we continue to make the difference in the healthcare sphere. So thank you so much again, both of you, and we'll collaborate again very soon for a next session to continue this discussion as well.
Thank
Thank you
you.
so much, Guni.
Thank you. Bye.
Bye bye.